everyone. I am Laura Hochman, a family medicine physician. I still practice medicine, and I am the medical matchmaker, CEO, and founder of Happy Day Health, where I help match physician-owned private practice and some non-clinical positions with some awesome doctors so that doctors can really enjoy practicing medicine again. I am so excited for today's guest. We have Dr. Funke Afolabi-Brown. She is not just an incredible physician, she's also an incredible human being, so sweet and kind and wonderful and brave. She has been featured on Baby Center, on ABC News, on other news outlets, and she is a sleep medicine physician who has her own practice. So welcome, Funke. Thank you so much for joining us today.
Thank you so much for having me.
Well, I'm excited. And we're going to chat today a little bit about what it was like for you to start your practice. And then also, as a tired mom of two littles, we may talk about some sleep things as well. So please know, anyone watching, feel free to comment. If you're watching live, type in #live. If you're watching the replay, type #replay. And feel free to put your comments or questions in, and Dr. Afolabi-Brown can answer them right here and now. So, Dr. Afolabi-Brown, can you please tell us a little bit about starting your practice? Was this just an easy transition? Did you just start as soon as you thought about it? How did that go for you?
No, it was not an easy transition. So it's funny, before you hit live, we were talking about the fact that I think it was about a year ago, probably, where I was just so torn, maybe a little over a year. I had been in academic medicine my entire career, and now I was thinking of transitioning to something else. And it was a very hard decision. And I knew, because of the work you do and the experience you have with working with so many physicians who have made transitions either from, being in a large practice to a smaller practice or vice versa. So it was just such an incredible conversation we had. And, fast forward, I'm the owner of a practice. I left my job and I really took that jump. And so it wasn't easy. It was a whole lot of, cost benefit analysis, realizing that I was leaving something that seemed, consistent and predictable to something that's been a little bit of a roller coaster somehow, but I would never have it any other way. I wish I'd done this sooner. It's been so much fun.
Oh, I'm so glad to hear that. And I've been cheering for you in the background. I'm watching you and following and seeing what you're doing. And every time I see you do something, I'm like, go Funke. And you know what I think is notable that's important for people watching to hear is you actually did not hate your job. Like, so many physicians are miserable in their practices. Just today, I spoke with 3 who are burnt out, and it's 11 a.m. It's 11 a.m. and I've spoken with 3 doctors already today who are like so burned out. But you weren't. And you still
Yeah.
decided to make that leap
Yeah.
into your own practice, which is very scary. I mean, I think from the time we spoke until the time you did it, I think we spoke a couple years ago now, actually. I think
Yeah.
it was about a year.
Yeah.
But there were a lot of barriers getting in your way of starting your own thing. Oh, it's all in our head. So what do you think it was that that held you back? You say you wish you did it sooner. What was holding you back from it?
That's a really good point you bring up, because a lot of people leave their existing position because they're burnt out and they need a whole different environment. But one of the things I say, even within my practice with coaching high achievers and professionals and a lot of burnt out people, is that you don't ever want to trade one form of burnout for another. So it's really making sure that you are in an okay place and you're making that decision not from a place of burnout, because what will happen is you're just going to jump into the next opportunity that may not be well suited for you. And you're just going to bring all that back into the new position you're in. And it's just a matter of time for you to get burnt out again. So I think what I needed to do, yes, I wanted to first address some of those issues. So I was at a point around the pandemic where I really started to think, right? A lot of us had a lot of time to do some deep thinking. And I knew I loved academic medicine. That was all I thought I wanted to do. I wanted to teach and contribute and do research and do all this, contribute to science and do all these amazing things. But I also knew that there was a lot more out there that was waiting for me. And I wanted to get out of the four walls of the hospital room. That's one. And then the other piece was, yeah, I was experiencing burnout because I was juggling a lot of things. I was taking on a lot of, responsibilities where I couldn't really have my time accounted for. And I had struggles with delegation. I had struggles with saying no. I had the superwoman complex combined with imposter syndrome. And I knew if I bailed at that moment, whatever I was going to do, I was going to bring all that negative energy with me. And so it wasn't so much about the environment I was in. It was about me making changes. So I needed that time to really figure that out. And so that was probably what felt like a delay, but maybe not necessarily a delay, right? Because if I was bringing all that, like just self-doubt and being so critical of myself and feeling like I wasn't good enough and just jumping into something else and blaming my organization, I wasn't going to be I was going to do myself a lot of disservice. So I would say for anyone that's out there that's considering making, I'm so sorry about that.
We got you back.
Yes, we're back. Except I'm having a little bit of a hard time hearing you. One moment.
Oh, goodness. Let's see.
Let's see. Can you hear me?
I hear you. Do you hear
wait,
me?
I can't hear you. There's a little bit of, I'm going to hop right off and then hop right in if that's okay.
Absolutely, sure.
Okay.
So for anyone watching, as a reminder, type #live if you're watching live, type #replay if you're watching the replay. Dr. Funke will be back very soon. And please feel free to put your questions in if you have questions for her about her practice or about sleep. We are going to talk a little bit about sleep. I know for me as a working parent, I wish there were more hours in the day. And so, what's the first thing to go is sleep. So if you have questions for Dr. Funke, please type them in here. She will absolutely answer them for you, especially if it's live. And while we're taking this break for Dr. Funke to rejoin, I'll tell you a little bit more for those of you thinking about starting a private practice. Here she is. We have a conference coming up. It is all virtual. There will be CME available. This is on May 31st through June 2nd. It's a conference on how to start your own private practice. So I will drop the link to that in the notes. But in the meantime, Dr. Funke is back. Okay.
Please forgive me. This has never happened before, but we're going to have this conversation because it's so important. So yeah, so like I was saying, I think it's so important to make sure you're dealing with those internal issues first before you make that decision to pivot or to move on to the next stage of your career. And I think that was really what I did. And I think that was very helpful for me.
That's so true. And a lot of when I speak with physicians and I say, what does your ideal practice look like? Or what do you want? A lot of physicians don't actually know because we've had that decision-making capability taken away from us. And you don't even get to decide what residency you go to. You go through the match. So we don't have that. And we also don't have the vocabulary for knowing what's even out there. So it's hard to do. And I really want to double down on what you said about really working on yourself. I have to say, when I started my business, when I started Happy Day Health, oh my gosh, I brought all of my workaholic tendencies in with me, and boy, did I burn out. And I was my own boss. And it's here I am preaching to everyone about don't work too hard. And my husband would say to me, you just made a video today on burnout, and look what you're doing. You woke up at 4 a.m. to work. You worked all the way until 10. I'm like, oh, okay, yes. So I'm better, but that's so true. You really have to work on yourself to know, what it is you want and how to make it happen. So I agree with you there.
Yep, absolutely.
And your practice is the restful sleep place, right?
Yes, it is.
So you see patients in Pennsylvania in person and virtually, and then virtually in New Jersey and California. Do you find it challenging to do sleep medicine by telemed?
No, not at all. I think the pandemic really taught us a lot of things, right? We got really, really creative. And especially when it comes to a number of patients that I see children and adults, right? For the children, a lot of them have behavioral issues, right? A lot of them may have sensory processing issues or, ADHD or just insomnia, right? And so for most of those, you can conduct that evaluation online. And so it really lends itself well actually to telemedicine. For those who maybe I'm concerned have sleep apnea, where I want to get a good sense of the airway. I could get really creative with looking at the airway even via telemedicine. But for those ones, I may say, you know what, let's have an in-person visit. I mean, for those who are in a different state and don't want to fly all the way to come see me in Pennsylvania. I also get very creative with those, and really it's partnership with the especially for the younger kids, really partnering with the family to know exactly and giving them the right instructions so that I could get a good enough glimpse of the airway to say, okay, you know what? We need to get a sleep study. Most of the time, depending on the symptoms, that's how I make that decision anyway, such that even if I have a child who doesn't, for instance, have big tonsils that I see, there are so many other reasons why they might have sleep apnea. So it doesn't necessarily change the decision to get a test done. And because after the test, they'll either be going to see, an ENT doctor that I know will get a much better evaluation of the airway than I will anyway. It lends itself really beautifully to telemedicine.
That's great. And it's so good to remind ourselves as physicians, we don't have to do the traditional in the office. You can do telemedicine, you can do whatever,
Yeah.
there's so much there. So let's switch gears for a minute here and talk about sleep. When you were reconnecting, I was saying, holy moly, as a working parent, there just aren't enough hours in the day. And so the first thing to go is sleep. So for the working parents out there, we're, waking up early, getting our kids ready, taking them to school. We go to work, we come home, we get our kids ready. And by the time they're asleep, it's 9 p.m. or afterwards. And then you have 30 minutes before you want to go to sleep. How the heck what do you suggest for working
Yeah.
parents?
I mean, I think let's be real, something probably has to go. So you have to figure that out. Like, really sit down to say, one, I would say, what's your doing a time audit? I think it's really important. Like, many times we feel very, very busy, but is it busy productive, right? Or is it busy unproductive? So I think starting with a time audit is important, right? How much time am I spending on social media? How much time am I doing tasks that I need to delegate? How much time am I um, you know, trying to make a decision where, maybe somebody else could make that decision, right? So I think that's a very good place to start. And then you now move to that place of mindset to think, okay, it seems like it's taking me more time. I don't feel more productive. Or maybe I'm trying to write this paper or submit this grant or send in this application, but it's taking me longer. And I would push to say if you're too busy to rest, it might be one of the reasons why you're not being as productive. And that happened to me personally, where I'm like, oh my gosh, no motivation to write or no motivation to do this research because my brain was exhausted. So it turned out what I needed was sleep and then, move things around and maybe like wake up a little bit earlier than before the kids get ready to get that work done. But I think combining those two is the first place to start because then that will help you to realize how important and how to prioritize your own sleep. And it's not something that's scripted, right? People might tell you, oh, you need to be in bed by 10 p.m. If that doesn't work for you, find what works. Find the schedule that works for you. Find the timing that works for you. And then you don't feel so much under pressure. You don't feel like you need to feel guilty. And you can really customize a plan that works, making sleep a priority.
So it's really being mindful and calculated almost about
Mm,
we need to make sure to plan this and do that
yeah,
at X time
yeah,
done.
yeah, yeah.
And
And be ready to let it go. Like be willing to let go of that perfectionistic tendency, right? So I think that's really important.
Oh my gosh, no kidding. Perfectionism. Yes, all the physicians watching this. Stop being such perfectionists. That's so true.
Mm,
Um, Another question I have is around napping, and
mm,
anyone that's watching, please chime in, ask questions about sleep, ask questions about Dr. Funke's practice. Um, so I've learned a couple of things. One is, don't ever nap, because then you're not going to fall asleep at night, because it resets your sleep circadian rhythm, all of that stuff. But on the other hand, I've also heard a 20 to 30-minute nap is great. And I saw you post about a nap you took once, and I thought, so what is correct from the sleep medicine physician's perspective? Can
I'm
you hear
having
me?
the same issue again. I'm so sorry. This is like the most ridiculous thing. I heard you talk about the nap. So maybe what I'll do is I'll talk about the nap because I know you can hear me. I'll hop off and then I'll go on. I'm not sure what is going on. But yes, I take naps. I think naps are my form of self care. I think the important thing about taking a nap is making sure that the timing is right. Right. So if you take a nap that is too late in the day, that's what impacts your sleep drive. Right. So that likelihood to not feel sleepy when it's bedtime is higher if you take a nap that's late in the day, right? And I always paint this analogy. Think of it like taking having your dessert before your main meal. You're not going to be hungry, right? So if you're going to take a nap, you want to take it like, depending on what time your bedtime is. Usually I would say after 2 p.m., you probably as an adult want to avoid taking any naps. And then, by the time you're ready to sleep, you don't feel like, you've depleted that sleep drive. And then the other piece is you want to keep it short. So if you're taking a nap that's like 3 hours long, I mean, you're not going to have much reserve in terms of sleep at night. So when you're going to take that nap, keep it, I would say, within maybe 20 to 30 minutes tops so that you get the best where you take the edge off and then you also can benefit from the benefits of a nap. It's been helpful with our mood, with promoting alertness, and so many other things. And so, really, you can kind of find what works for you. Now, if you're at a point where you realize that you need a nap all the time, I want you to step back and say, why? So, the reason why could be that you are chronically sleep deprived, in which case, I would rather you focus on extending your overnight sleep, or you may have a sleep disorder, in which case you need to come see me. So I think those would be the caveats when it comes to, taking that nap. I think that's really, really important. What I'll have you do, I know you were talking about the program that you have coming up. I'm just going to hop off again. I'm not sure what's going on, and then I'll hop right back on.
Okay, wonderful. And I'll also add here, I have Dr. Funke's website. Let's see if we can get it up. It is restfulsleepmd.com. So if you would like to see Dr. Funke, it's restfulsleepmd.com. I'll tell you again about the program, but again, please put any questions you have for Dr. Funke in the comments. The program is May 31st till June 2nd. It is a private practice 101 conference. So anyone who is curious about starting your own practice, we're going to have physicians who've started their own direct primary care practice. We have telemedicine only practice. We have insurance based. We have all the things needed. So we'll be talking about personal finances. We'll be talking about finances in the practice. We'll be talking about billing, lawyer things. We're going to have the incredible Amanda Hill speaking. So if you're curious about private practice, you got to come see this. It's through SoMe Docs. And I would love to see you there. So head to somedocs.com and go ahead and find it. And I will, once this is done, I will paste the link to sign up in the comments. So here we have Dr. Funke, and I was just telling them that your website is restfulsleepmd.com. Is that correct?
Yes, it
Okay.
is. Yes, it is.
Perfect. All right. Well, we just got done talking about naps,
Mm-hmm.
and um, on that note, you said, if you're chronically tired, maybe look for a sleep disorder. So
Mhm.
the things we commonly think about um, would be, not getting enough sleep, maybe drinking too much caffeine or narcolepsy. What other sleep disorders are things that maybe we don't think about?
I love that question. So, really, to make it easy, what I try to do is let's categorize this into three different categories. The first, I would say, when it comes to just sleep issues generally, are the behavioral sleep issues. So, the things you just talked about, like taking caffeine, taking too many, too long, and too late naps, drinking alcohol. We kind of call them poor sleep hygiene. So those are behavioral things that could impact your sleep. Watching TV just before bed, or engaging in social media or other stimulating content just before bed. That can affect your sleep, right? The second category would be some kind of the medical sleep issues. So what's that? That's sleep apnea, right? Insomnia, narcolepsy, restless leg syndrome. And, they're also what we call circadian rhythm disorders. I'm sure you've probably heard people talk about being a night owl, being a morning lark. All those things can actually impact your sleep. And in some situations, it can lead to a disorder. And so that's the second bucket. And then the third, I would say, are kind of like the 24-hour factors. So, what are issues that are going on, like anxiety, right? Low level, kind of just brewing under the surface, anxiety, ADHD, depression. Those things are there 24/7, right? They don't go away. Your anxiety doesn't necessarily go away when you're about to sleep. So, those issues can also then contribute to sleep disorders. And I think that's why it's so important to, I know, almost like do a check, like where am I struggling? Why am I struggling? Because the most common way it will manifest is, daytime sleepiness. So if you're so sleepy where you need naps frequently, or nighttime sleep issues where you have very unrestorative sleep, or you're having a hard time falling asleep, you're having a hard time staying asleep, or you're waking up super earlier than you would like. And it's been going on for a while, especially if you've addressed some of those behavioral factors. That would be the time to say, okay, I should get this checked out.
Yeah, I love that. I have a quick question, then we have a question from our audience. Um, you said avoid social media, avoid screens. What about the Kindles? What about an e-reader?
Yeah, I'm a fine. And honestly, I don't. I try not to be so scripted. Like people are like, you mustn't be on TV for 60 minutes. I mean, come on, right? I think it's more than being on screens is, apart from the blue light you get from these different screens. I think an e-reader, you can get it into the night shift mode. Even your phone, you can get onto the night shift mode, right? So in those situations, it's fine, but more importantly, paying attention to the content. Like, is this content that's activating? Is this content that's going to keep you awake, that's going to make it hard for you to wind down? So I think that's the piece that you want to pay attention to. And then what is the impact of the time you're spending on screens? What is the impact on your sleep? Is it displacing your sleep time? Is it something that you could say, okay, I'm going to just, consume this content for about 20 minutes, and at 10 p.m., I'm going to put it down? If you're not able to put it down, then it's something that you probably need to stay clear of, right? So, so I think it's beyond just no screens. It's really one of those three. So, is it too activating? Is the blue light and the exposure, is it suppressing your brain's ability to shut down to sleep? Or is it displacing your total sleep?
That's good. All right. Well, let's get to this question. So this is from Haley Ad. Regarding planning a nap, should you be factoring in the amount of time it takes to fall asleep into that 20 to 30-minute window?
Oh, that's a great question. So it sounds like the question is, if it's taking you, so that's a really good question. If you are taking a nap, and I hope this answers it, please let me know. If you're taking a nap and then you start to realize, oh, wow, I used to fall asleep in 10 minutes. And since I started taking a nap, or the days I take a nap, it takes me 30 minutes or more to fall asleep, then your nap may be either too long, it may be either too close to bedtime, or you probably don't need a nap at all.
Mhm.
Because the way this works is the moment you wake up, you start to build what we call a sleep drive, right? So your sleep drive, think of it like an appetite, right? When you had a meal, you're not hungry anymore. So when you wake up in the morning, you're not hungry for sleep if you had good sleep, meaning that you don't have a medical sleep disorder. And so that sleep drive sort of accumulates over the course of the day. So think of it like you're accumulating a drive. When you take a nap, you're going to drop that drive, right? So you need time to build up that drive. There are other things that can drop that drive. If you've been super inactive, right, during the day, you're not really active, you're not outdoors, that can also drop the drive. So a few things go into that. But most of the time, if you start to notice that it's taking you longer to fall asleep, I would work on just establishing, increasing that sleep drive, i.e., either making that nap super short, super duper early, or probably don't take a nap at all.
Okay, interesting. Or, just kind of thinking about the days when I really needed a nap and couldn't fall asleep.
Hmm.
Those were days that I was really stressed out. So probably
Yes. Yeah.
would have been better to just go for a walk or do something else,
Yes.
self-care-ish.
Yeah.
Um, yeah,
Yeah.
that makes
Yeah.
sense.
Yeah. Stress is a big contributor. Stress.
Yeah.
And you may have taken the nap, and maybe originally you would have been able to fall asleep, but you got stressed in between the nap and bedtime.
And then you get stressed that you can't sleep, and then
And then you get
then it just
stressed.
keeps going.
Exactly.
Uh, okay. Well, okay, we got some clarification. I was thinking more along the lines of if it takes, for example, 10 minutes to fall asleep, should I be planning for a 30 to 40-minute time window for a nap instead of planning for 20 to 30 minutes?
No, no, no. If it's taking you a while to, I would still aim for about, I would, so this is the way I recommend doing it, because you also don't want to take a nap that then, you know what, I take it back. There's no absolute, right? Your own unique situation is unique to you. So, but here's what I would recommend. I would recommend that if you do feel like you want to take a nap, set a timer to go off or an alarm to go off at 30 minutes. And whether you did fall asleep, whether you didn't fall asleep, you were in a state of rest. And usually that's what I would focus on. So, and if you were laying down and you fell asleep about 5 minutes before that alarm went up, my suggestion, again, it's unique, right? I don't know the full picture, would be to just, okay, at least I've had moments of quiescence where I've just been able to be and to rest. Um, and then just take it from there.
Okay,
Yeah.
great. Did that answer the question? Let's see if we get an answer here. Um, okay, let me ask you one more question before we jump off. And if anyone has questions, please add them on here. Question that I see a lot in my patients who are mostly, or actually now all adults, but I'll have adults come see me for sleep issues. She says, yes, thank you. You're very welcome. But really, it's their sleep issue. So I'll have parents come to me saying, my kid is very anxious and they refuse to go to sleep by themselves. I'm
Mm.
exhausted from just being with them 24/7 because, they're too scared to be by themselves. They want me to sit in their room until they fall asleep. But I feel torn because, on the one hand, I want them to feel safe. On the other hand, I want them to learn to fall asleep on their own. And this, all ages, but typically older, like 7 to 10 age group. What do you suggest to those parents?
I would say, for your sake and also for their sake, that they learn how to sleep independently. It's going to benefit everybody. So if you think about it, especially at night, all day, at least to the best of your ability, you filled their cup, you've nourished them, you've poured into them. So they may feel that guilt of, oh, I'm abandoning my child, but that's not the case. Really helping your child. And there's so many ways, there's so many strategies to go about this. But if you kind of think at the back of your mind, I'm teaching this child to learn skills that's going to last them forever, right? If I can teach them to sleep on their own and teach them to sort of self-regulate and self-soothe, they are better rested. So the likelihood of them getting short sleep is less. I'm better rested because now I can really focus on getting the rest I need. And we're just a perfect, beautiful duo in the morning because we're both well rested. so I think that would be the idea behind it. And yeah, and then also getting to the bottom of the anxiety, right? Some kids may have anxiety during the day that translates into bedtime. So it's important to say, where is this? Is this child someone that's difficult when has a hard time when we're separating during the day? Is this a child that gets super frustrated very easily with tasks? Is this a child, you know what I mean? So you really want to see and pay attention to those things, because if they have underlying anxiety, then of course we want to address that.
Right. Address the underlying issue behind why they're
Mm-hmm.
having their sleep trouble.
Yeah. Mm-hmm.
Can you give us an example of maybe a success that you've had in your practice or with your patients or for yourself that you'd like to share?
Yeah. I mean, because I do take care of children, I do take care of adults as well. I think I'll give an example of an adolescent. So somewhere in
So in
between
the middle.
that has like issues that some kids might have and also has issues. So I had a patient recently who just had, I mean, high achieving female. It's so incredible, teenager who was in track and had all these awards and was in like AP classes. And so she was high strung. She just had a really hard time sleeping. And she was bright as ever. And so she had done all this research on sleep. And of course, when you go out there and read Dr. Google, what happens when you don't sleep well? And she was like, oh my God, I'm going to die young, And so that was just constantly playing in her mind. And she would have so much anxiety at bedtime, to the point where she would be crying unconsolably about not being able to sleep. It was really heartbreaking. And so we went through, one of the strategies I use is cognitive behavioral therapy for insomnia. And so going through that, first of all, putting in some strategies to help her learn to cope with being awake at night. I think that was so empowering, because by the next time I saw her, she's like, oh, I mean, I sometimes wake up and I have a hard time sleeping, but I don't feel paralyzed in fear. And I think that was so powerful. And then, of course, we also did, parts of CBTI is, stimulus control and also, bedtime. We call it bedtime restriction and things like that. And she's just thriving. And so seeing that, we didn't even usually the insomnia program lasts about 6 weeks, but in 4 weeks we were pretty much done, and so I think it just was so powerful to see that transformation. This is someone that I've been struggling for years, right? So I think that's an example of a success story. And, I do the same with the adults. I do the same with teenagers. I mean, for younger kids, we put in more behavioral type strategies, but they're also very, very effective.
Oh, I love that. Changing the world one nap at a time.
Ah! I'm going to have to steal that from you. I
Steal
love
it. Take it. It's all yours. um, well, I would love to hear from you. If you could go back in time to when you were finishing your fellowship, what would you tell yourself?
I would say be flexible, because as you're growing, and don't be married to your dreams in that sense, because they might change, right? So for me, for instance, I saw myself in this beautiful, grand, big institution where I would be a professor and be publishing papers. And I did some of that. I mean, but I realized there was so much more out there in terms of impacting my world. And so initially it was a struggle, because I'm like, well, no, but I'm supposed to be blah, 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 blah. And I became flexible to say, I wonder if this opportunity of pivoting or really changing the direction of my career will help me to create the impact I'm looking to create, actually even faster and larger. And I would say I just ran with that. And so having that flexibility is something I would have told my younger self. And I would encourage anyone that's on this journey. And also just being curious, right? Like, until you explore, you just really never know what's out there.
Oh my gosh, that is so good. You know what? I think I may feel the same way if I went back in time. I would
Mm.
also go back and, I think I told myself be flexible, but I wasn't flexible.
Yes.
I knew what I wanted and I went for it. And that was that. And so you got to be careful what you wish for. You might get it.
Mm,
All right. So
mm.
for people watching, where can they find you? Either, for coaching or sleep medicine, where can you be found?
Yeah, the first place to go is my website. So www.restfulsleepmd.com. And there you'll find, different sections. My coaching practice really focused on moms, particularly high and professionals. And also on there, you'll find the link to my practice. So if my clinical practice, so if you're in Pennsylvania, if you're in New Jersey or California, you could schedule an appointment and then we'll be able to see you and discuss what your sleep needs are. And then I have a blog, so you could just read, and just consume so much content on there. I believe the link to my YouTube channel is also there. So I create weekly videos. I also have candid conversations with different guests and things like that on there where we talk about sleep. And so there's a whole lot of ways you could benefit from my work. I'm also on social media. So I'm on I'm on LinkedIn as Dr. Funke Brown. And then I'm on Instagram at Restful Sleep MD.
Oh, wonderful. Absolutely go check Dr. Funke out. She's a wealth of knowledge, a force to be reckoned with, and a total phenom. I feel blessed to know you. So thank you.
The feeling is mutual. Dr. Lara, I really appreciate your
Oh.
support and just the work you're doing within the physician. You are changing lives. You are changing lives one job at a time. So thank you. Thank you for the work you do.
Oh, you're so welcome. We have a quick question that I'm going to sneak in.
Okay. Sounds
Someone
good.
asked, it was Haley. I'd like to ask one last question. How much deep sleep is the average adult recommended to get overnight?
It varies by age. I mean, usually we'll say about 20 to close to 25%, but the level of the percentage of deep sleep decreases as you get older. So a lot of times children have, close to 40%, and then over time it decreases. But I wouldn't obsess too much because I suspect you're tracking that deep sleep data with a with some kind of tracker, no judgment at all. Um, so make sure that it's not something you're perseverating over. Listen to your body, because one thing I've seen with a lot of these trackers, even the most sophisticated ones, is that they oftentimes over or undershoot on what you would see from a typical overnight sleep study, which is really the gold standard. They're good for checking in on trends. So, oh, how much sleep did I get overall? Okay, I noticed that when I get when I go to bed later or I watch TV, I'm getting less sleep. So it's good for watching trends, but I wouldn't obsess so much on that because I've seen people come in with all their data and like, my data says I got only this amount of deep sleep. I need help. And I'm like, how are you feeling? Oh, I feel fine. But my data. So I think it's really important to pay attention to how you're feeling and addressing that so much as letting that data drive you.
So just like we treat the patient and not the number, it's the same thing. We treat
Yeah.
our own sleep by how we
Mm-hmm.
feel.
Mm-hmm.
Thank you. Well, I could ask you questions forever and ever and ever. So I'm going to go check out your blog and I'm going to check out your YouTube channel because there is not enough time in the world for me to ask all my questions. It's
Oh
such a good
man.
topic. Well,
Oh.
thank you so much. Go check out Dr. Funke at restfulsleepmd.com. And of course, if you're a physician looking for a private practice or a non-clinical opportunity, please check out my website, www.happydayhealth.co. And thank you all physicians for what you do. I really appreciate you all. And together, let's take back medicine.
Thank you.